Hi, and welcome to a special episode of our Experiencing Consciousness podcast. We are
Roxanna Erickson,
Catherine Rossi,
and I'm Jan Lipa.
We are so happy you are here.
Hi, and welcome to another episode of our podcast. Today we are here with Dr. Catherine Rossi and Dr. Roxanna Erickson-Klein. And well, my first question, we're going to be talking today about the ideo-motor signaling. And my first question goes to Dr. Roxanna Erickson, who was the originator of the idea of talking today about the ideo-motor signaling. So, Dr. Roxanna Erickson, why is it important to actually talk about ideo-motor signaling now? And what is it actually? How would you define it? Because I know that there are some people that define it differently. How would we define it for our conversation?
Okay, well, I'm going to start out with the part of why it's important. And this has come to my attention in my international teaching, where I've worked with people who are familiar with hypnosis in various parts of the world. And it came to my attention that there is a lot of either misinformation or basic ignorance about what does ideo-motor signaling actually mean. But when you look at the American Society of Clinical Hypnosis standards of what a beginning hypnosis student is expected to become familiar with, ideo-motor signaling is one of those fundamental processes that is integrated with both beginning and advanced hypnotic work. So that's why I consider it to be important. Now, on to your second question, is what is it? And what it is an unconscious response that comes from within yourself at a deeper level that your conscious mind is not necessarily aware of, and in fact is optimally not aware of. And so the way it is expressed or used, there is a whole multitude of different ways that this is expressed and is used. But in the context of teaching hypnosis and integrating ideo-motor responses into your formal or informal hypnotic sessions, there is a multitude of techniques and expressions which are individual to the hypnotherapist, that is, how they've been trained, what they're looking for, and how they invite the subject to respond. But whether or not the hypnotherapist, trains the subject of, we're going to be using ideo-motor responses, and let's, identify these fingers, this your yes finger, your no finger, your I don't know finger, and your I don't want to respond finger. That's one of the more common ways to teach ideo-motor responses, but it is so far beyond that. And it can be much less formal, just an expression or a nod that the person has, or it can be really a much bigger response that's never even talked about as if it's ideo-motor. And Catherine, your hands technique is definitely idiomotor, and my dad's arm levitation technique. That too is an idiomotor response.
Well, and ideo is the idea gives rise to a motion. You know, it's
Yeah.
a mind body or body mind thing. So it's when you take the two words and put them together, it makes perfect sense that you're working with the whole person. And so it's considered a technique, you know, in different forms, particularly, you know, the Rossi Cheek book, Mind Body Therapy, you know, ushered in a lot of this. And it was that where the fingers got different meanings. It could be the five members of your family, for instance, that, you know, so that you're literally projecting the unconscious process within the fingertips. But the idea gives rise, I would say, to action. You know, ideo-motor, you're actually, an idea is moving. And why is that so important? That when people come to therapy, if it's all talk, like we're known for that. Oh, you know, you come and you talk it through. Well, when you come to see someone in therapeutic hypnosis, there's not the, you can go long periods of time with no talking. It's not the linear mind that's moving you forward. And so the surprise when your hand is doing something like, you know, it's levitated like this, and try as you might, you cannot push it up or down. And you realize, oh, I must be in a really deep trance because, and so there's a certain feedback that's not just for the therapist, but primarily it's for that client to realize I really am in a different state of mind.
So it's also
I'm stuck.
so it also ratifies the trance, not only kind of it works both ways. You there needs to be a trance to evoke those processes, but also when they are evoked, they enhance the trance and kind of convince people or so to speak ratify the experience, convince people that are in a trance that they are actually in a state that is different. You know, Dr. Catherine Rossi, I was also thinking since you mentioned the book on the
Mind body therapy.
yeah, mind body therapy. I think is it in this book the first time, or maybe in experiencing hypnosis that Dr. Rossi, maybe together with Dr. Erickson or with Dr. Cheek, actually uses more broad term of ideodynamic processes also.
Yes, you know, well, it's in the same realm. And that, you know, that one of the things that's really expansive about language is that meaning is within the person. So dynamic might mean something much more to one person than motor, for instance. But the ideo, and what I like about ideo, obviously I'm saying it's an idea, but a derivation of that, and I'm going to make you laugh, is like idiot. And I like the play on words, you see, because when you think that you know something before you actually know something, I would say you're a fool, right? So, but when you think of, you know, that the hand is moving, or the head is in an odd position, or, you know, like unusual things that are happening, it shifts the person away from regular consciousness. It makes a disruption. And whenever there's a disruption, there's a chance for something new to come up, a new idea, a new way of being, even, where you don't have to have words to it. You just plain feel really relaxed, whereas you were anxious before. So I'm always amazed, to be honest with you, why this concept is difficult at all to understand.
Well, one historical reference I want to make is David Cheek was a colleague, a contemporary of my father's. And my dad was not big on using hand signals, with the exception of arm levitation. That he used very, very frequently. And he used it mostly for trance ratification. And he used it as an induction technique, and he used it, because it was an easy and a visible way to put somebody into a trance. It was just something he seemed to enjoy doing, and made a good teaching demonstration as well. But David Cheek was much more into the exploratory, let's get back to your history or the history of the problem or working through the problem, but we don't want your rational mind to be doing it. We want your automatic gut or your body. We want your body mind, the wisdom that's in there that you're not aware of, to be answering these questions. So David Cheek really championed this exploratory process of letting the subject enter into a trance and then identifying this finger means this finger means that, whatever, ascribing meaning to the specific signals, and then pursuing the interrogative of, when was the first time you felt like this? Was it before you were 5 years old or after? And then looking for the finger signal that would guide the next question. So Cheek is the one who really developed and popularized and made that available to clinicians who were more oriented to that style, therapeutic style of the exploratory search. And one of the things that I admired so much about Ernest Rossi is that when he came to study Dad and realized that he wanted to learn more about what Erickson had to teach, he didn't narrow in. He expanded out. He's like, well, here's David Cheek that is practicing in a completely different way. They respect one another, but their style is very different. And I was really in admiration of Ernest that he wasn't a blind follower. This is what Erickson says is right. He opened his mind and he says, what's out there? What can I learn? And then he, like we, developed our own style of where does Ideo-Motor fit in to our personal style of practice.
Yes, I think that, and Jan, for your profound interest in deep trance, that you use Ideo-Motor signaling, a fair amount.
Yeah, that's true. But you also do it, I think we all do it. And actually, I was curious because Dr. Roxanna Erickson, you say about the personal styles. So naturally, my question to this was, what are your personal styles? Talking to you and Dr. Catherine Rossi. So maybe I'll ask that question, and then in the end, when you say about how you utilize the Ideo-Motor signaling, I could tell you a bit about how I do it. But I think we're gonna have some common denominators and maybe some differences that can be interesting. So I just gonna throw the question to organize everything in certain way. What are your personal styles of using and utilizing idiomotor signaling and maybe even ideodynamic processes in a therapeutic setting?
I probably use it the least of all. And I would say that I use ideodynamic formal trance work, because when I ask questions, I am looking with laser eyes on an individual's color, breathing pattern, tension in their body, where their eyes go, that type of thing. Those are all ideodynamic responses, but I use them prior to formal trance work. And so when somebody comes in and I ask them, what would you like to work on today, or what's your priority today? That's when I'm looking to see, well, what is their physiological response to that question? And that is even more important than whatever words come out of their mouth. But the way I practice is I reach really this conscious agreement with the individual. If we're going to use hypnosis, then I'm not looking for an interactive trance work. I do not use finger signals. Occasionally I will ask for a nod. Let me know when you're comfortable. Occasionally I will ask for a nod. And occasionally when I want them to remember what they're processing, I will give very explicit directions of find your voice and keep your voice, connect with your voice, and let words come to you that you will remember. So I use a proposed hypnotic suggestion that they find their voice and that they remember what words are meaningful to them. But aside from that, the formal trance work that I use in my office with most of my clients, it is not what you would typically refer to as idiomotor signaling at all. And I'm really curious about hearing the answers of the two of you.
Well, I think that that I'm smiling because, yes, Roxy, you have a formal way in which you do things. That is your style. Mine is informal. And I have no idea where we're going or how we're going to get there. That's what I bring into the room. And I follow, I don't lead as a rule. And so I'm following some of the same things you're following in the beginning. I'm following, what is the eye blink response, for instance, what's happening with respiration. And is a person moving at all, or are they very still? And most often people, they like to talk with their hands. So you see these hands moving, and sometimes the hand is, you watch their hand and their hand is pushing something away. And so I will have that be the way that we proceed. And it's like, what's it you're doing with your hand? Then they immediately stop. It's like, no, keep doing that. What is that? Really feel that. And and it's like, well, I'm pushing away. I don't want this. Oh, there's something you don't want. I really don't want. I mean, there's like this sort of thing. And as they're going deeper and deeper and deeper into trance without me even trying to do anything. And when something Jan and I were talking about the other day, the merry symptom chase, what Ernest and I, wrote the book on the symptom path to enlightenment. And part of what happens in there is following the symptoms. You follow the symptom, then the symptom changes and it becomes this and this and this and this. And it has a tendency to traverse through the body. So, so it becomes really, really interesting, just watching what people are doing. And sometimes that this is not so usual, but someone will put a lot of tension into their foot and they'll be pushing their foot into the floor. And you're looking at that and saying, well, that's kind of an unusual way to sit in a therapist's office, isn't it? With you, cramming your foot into the ground. And so, so then it becomes natural. I wonder what that foot is saying. What is your right foot saying right now? Well, I don't know. What's it doing? Because they're not necessarily aware of all of these indications within their body that are processing whatever their dynamics are. So and because it's informal, it's a little bit more difficult to actually talk about. When a person gets into a catatonic state, in whether it's with a hand, whether it's with an arm, whatever it is, I get really excited about that. Because I know that there's a split over here that's opening up something else over here. And so often I'm following, not really knowing until maybe later, if at all, of what is actually happening within that person.
Well, when you were talking about it, when you were giving the example of the foot, and you said that you are asking a person, what is your foot doing right now? Something like that. There are so many implications to that one question, For example, this is a dissociative statement. Suddenly the foot has a life of its own. And so it also, since at least to some theories, the dissociation is a basis of any hypnotic phenomena. So when we are actually facilitating it, we're deepening the whole trance experience. That's another thing from the mechanics of a trance. But also suddenly whatever the foot does, it becomes meaningful. And so that changes a lot, because suddenly there's a meaning attached to something that may seem at first just habitual kind of thing. People sit and they may just move their feet or whatever in a certain rhythm. And when you ask the question, what is your feet doing? What is it actually doing? Adding actually, for example, to that statement implies that it's something important, and that it's something different than just creating a movement,
Or
So,
even the micro movements.
yeah,
The micro
exactly.
movements are so interesting when a person starts shaking involuntarily, which is so common, and it could be so frightening if you're just in everyday life. It's like, oh my God, am I getting Parkinson's disease? I mean, it's an odd thing. And then to help to normalize, oh, this is a mind-body signal.
Yeah.
Oh, how sensitive you are right now. Even sensitive to the point that you can see those fingers moving, but
Yeah.
barely.
Exactly. And when you think about that, I'm thinking about utilization of that in, for example, when people have panic attacks and they have difficulties in reading their internal body signals, and they misinterpret them as catastrophic and as leading to some catastrophic. And suddenly you give them some totally different mental frame to interpret all those things as signals from the mind-body communication.
And release.
Yeah,
you know, that
exactly.
that when there's a shaking, there's a release.
Yeah, or from the
You really
unconscious, as Dr. Roxanna.
let it go. Like, let that release continue. Let it go.
Yeah.
So, Jan, I'm really curious about how you use idiomotor signaling in your personal practice, and what is your style?
Okay, so I will not be able to get away with this. Okay, so you know, when I'm listening to both of you, I think I'm using both these styles and something in between, since I'm the core of myself is strategic. I always try to whatever I do in hypnosis, I do it for some purpose. So I've got some idea in mind that is obviously tailored to a client and, you know, individualized. And in so doing, I'm also very open and open-ended. So when Dr. Catherine Rossi said about how she works, I was like, well, that's also what I do. But at the same time, parallel to that process, I've got in mind all this mathematics going on and thinking to myself, this is interesting. This is something. This can be a interesting hypothesis. Let's check this one. Let's see what happens here. And suddenly everything builds up into a multi-level indirect kind of way of working, in which ideodynamic or idiomotor signals are an important part. Dr. Catherine Rossi mentioned that I'm interested in deep trance phenomena, and in this realm, idiomotor signals play at least few roles. First of all, that we already mentioned, that one is that they ratify the trance experience. I'm thinking about a particular case where there was a person in my office that was going through trance experience and was actually pretty deep, and I needed to set the signals, the idiomotor signals, to ask some questions directly to the unconscious, let's say. And so in setting those signals, I said that the unconscious may now decide which finger will be the yes finger. And so there was a certain the one of the fingers started shaking, and the person was very amused, but not so much. But then I asked, and then your unconscious may also take a while to decide which finger will be the no finger. And the no finger was this one, the smallest one. And the person looks at the hand and says, totally puzzled and totally shocked, and says, I thought, I was betting it's gonna be the fuck finger. You know, that was the description. And that was the moment when they actually realized that it is happening somewhere else than just on a conscious level, that the prediction from the conscious mind was different than the outcome from the unconscious. And that ratified the whole experience and enabled us to go even deeper. And also, so I also use them. So this is one thing. The other is that they are actually serving as behavioral markers of the process. So, you know, I can tell someone that they can go into a deep trance, deep enough to, for example, go, you know, become a bodiless mind, float back in space, go back in time, whatever you want. If you want to go into regression or something, you can say something like that. But I have no idea when it's going to come to this point. And so many times people that are actually, you know, kind of when they are hearing those kinds of statements or suggestions, they don't know when it's going to come out. But when you have for example, when your hand is in a levitation process, then the levitation facilitates the trance and also ratifies it. But also you can say that your unconscious can go deep enough to become bodiless mind, for example, and forget that you have a body. And I don't know how much time it's going to take, but I know that this hand may slowly start drifting down to your lap. And I know that your unconscious can take as much time as it needs to go there and to, create all the necessary adjustments, whatever there is. And when this process will be over, or when it's going to be well developed, whatever we want, the hand will be on the lap. And then you know how much the process takes, and the patient knows that, and they expect it to take some time, and they look at at it with positive expectancy, which is one of the things that actually facilitates the whole process also. And when we're gonna look at the article that we did with Dr. Catherine Rossi about how to create deep trance phenomena, and we created and we kind of established there are 3 levels of the trance depth. The first level is actually Ideo-Motor suggestions. So to me, in my mind, everything starts with Ideo-Motor because it's fairly easy to achieve some Ideo-Motor responses, because in hands, for example, because that's going to be another question that I actually have for you, because it's actually interesting why we are using the hands. So I just going to say that we are using them for certain purpose, not that it's better to use hands than legs, for example. But exactly. So I was like, so the easiest thing to do in terms of hypnotic phenomena are some Ideo-Motor signals. And I think that's why Dr. Rossi, correct me if I'm wrong, but that's why Dr. Rossi said that the hand mirroring is actually fail-safe, because anyone can tune into their hand. So we start with this, and when someone can do the hand levitation and make the hand go slowly down, they can also create, after some experiencing this for some time, the hand going up. And then they can experience the hand going up on its own, and the fact that they can try to stop it, only to find out that they can't. And that's the second level of the trance depth, where you can experience the challenge suggestions, where you say to someone, you can try to stop it, only to see that you can't, and that's a bit deeper in terms of research on the subject. And then from this, you can go and develop some cognitive distortions, like, for example, perceptual distortions, like, for example, hallucinations, or more deep regression, things like that. So in my case, anything starts with the Ideo-Motor signaling, because it's the most basic form of dissociation that people can experience, and that in this experience they can facilitate and ratify the trance, and then go further with anything that they need, any phenomena that they need to elicit to create significant change afterwards, or anything else, So it's actually pretty big, although some people can say that it's easy to achieve this, but this is the beginning of any form of change in the way I understand it.
It's also how we come out of trance. There's an ideomotor signaling.
Mm-hmm.
It's like, when the session is finished, there's only so many more minutes left. It's time to reorient. And the question becomes, I wonder if your eyes will open first,
Yeah.
or if you'll find yourself moving, in your
Exactly.
chair. And so it becomes a reorientation. But I think that's the other place that we all commonly use it.
That's true.
So One additional comment that I want to make is that the hand floating up and the hand coming down, those are some of the basic training when training a professional how to elicit a hypnotic trance state. Those are some of the earliest techniques that people are taught, or putting their hands together and you can't pull them apart. That's another one. But one of the things that I like about the hand levitation is that you can then invite the subject to open up their eyes and see their hand, and you can reinforce that. So you're doing that trance ratification, but it deepens the dissociative process, really profoundly deepens it. And it also, and this is what I like so much, is that it gives the subject permission to open up their eyes and look around without interrupting the trance process. And I think that lots of times with beginners or people that get into habitual ways of using hypnosis, they have the thought that, well, the subject has to have their eyes closed. But in reality, the subject can have their eyes open or closed, and either one of those responses can be used to deepen the trance, to enhance the dissociative process, to allow them to do their inner exploration in a more useful way. So
Exactly.
it starts out, it was actually, that's the easiest thing. And I just want to have one more comment about my dad, that he was, I don't know if he is really the one who, discovered or created the hand levitation. I know some sources credit him with developing the hand levitation. I'm not 100% certain that that's accurately credited, whether he learned it from a predecessor. But one thing is for sure, he loved doing the hand levitation, and that was kind of his favorite teaching technique, and he used it on me to the point where I recognized on a conscious level that he's teaching me trance and I'm having this hand levitation response, and I can hold my hand elevated indefinitely. And he would leave me seriously for hours while I don't even know what was being worked on, or whether it was just the hand levitation that was being worked on. But he would leave, he would extend the teaching sessions with me to go on for a prolonged period of catalepsy, that as I think about it, as I got older and more sophisticated and started questioning what was going on there. and of course, there is a lot of things up here in teaching a child, like patience and learning new skills and a relationship with their body and this and that. So, but I can't say that I fully understand it. But one of the things that, that did come out of those teachings with my dad is that he would elicit a hand levitation posture and use it for a prolonged interval of time.
And he did handshake
Yeah.
inductions as well, which has always been fascinating. I never learned how to do that.
You can do it in a minute, and next time I see you in person, I will teach you.
The next time we're together, you can teach me that one. But I know that that one day Ernie asked me if I was interested in the hand levitation, and it's like, sure. And he reached over and very gently got, his thumb and, and forefinger, and barely was touching me, but a slight motion upward. And then he let it go, and I was in catalepsy. But it was that the gentleness of the touch, it was the smallest kind of suggestion, and then the rest was like up to me and my unconscious mind, and that's what was fascinating. It's like, you think that it was a big deal, and yet, that what is it in us humans that find comfort in going into that space? The catalepsy, the healing that's going on, that which you don't even know what's going on. And I didn't realize that your dad left you there for hours. Hours. And said, but then when you think about the profundity of being able to hold really an unnatural position like that, for long periods of time, it's like, if we could do that as humans, what else can we do? Like, that it's, you can hear the excitement in my voice of the fact that it's almost like inside of me, everything is possible. It's like, I think I know nothing, but what could I learn? That's what goes on inside me with it. And so, but it's like a lot of things are seemingly simple, and I cannot ascribe a single time that I've done hand levitation, and I do it with myself all the time, because I enjoy it. But it's like I go into a place that's different. There's a different level of healing and experience that is profound, but it's absolutely indirect for me.
Yeah, you actually pointed out very important thing, the importance of the touch, and that it also becomes the indirect suggestion here. I believe that the most detailed description of how to do it was actually in experiencing hypnosis, right? Together with actual images on how to actually grab the hand and everything, that the touch needs to be ambiguous, for example, because then you create, what does it mean that you create catalepsy? You suggest both movement up and down at the same time, so that the hand kind of stays like that, and doesn't. That's how I remember from the description, and how it actually works for me. Also. So I mean, I actually have one question to before I ask another question that I wanted to ask. I've got one question to Dr. Erickson about the use of handshake induction by Dr. Milton H. Erickson. I've heard once a story, an anecdote about the first time he actually used it, that it was at the conference of some sort, that some guy came up to him and said that hypnosis doesn't exist or something like that, and he asked him to come to the stage, and that he hypnotized him doing the handshake interruption. I've heard that somewhere. So I guess my question is, do you actually know how it actually how it developed, or how it was, how he came to this idea of handshake interruption?
Okay, so I'm familiar with that story of the individual in the audience, the man in the audience who was very outspoken that no one cannot be hypnotized. And then Dad invited him up and using the handshake technique. I can't say whether that was the first time he used the handshake, that I have some degree of uncertainty about. But I do know that he was on this almost like on an individual quest to find new ways, to find new opportunities, to discover more of this expansive, exploratory mindset where he was wanting to teach that you don't have to have a rigid protocol for putting somebody into a trance. You can use anything. And so here's an opportunity. And so that was really his mindset. It was whatever happens, let's go ahead and use it and go from here into a state of trance. So one other comment I want to make about the handshake induction is what he does is he takes this kind of a standardized the expectancy of an ordinary, typical formalized routine of shaking hands, shaking hands. We all, in our culture, we know how to do it. We know what's expected. We know we can get feedback from the individual. Do they have a vice grip handshake? Do they have a dead fish handshake? Are their hands warm or cold? Do they pull away or do they linger? So the handshake itself, which is a very routine, ordinary greeting in our culture, is really an opportunity to gather some basic information about the individual that you're connecting with. And people don't usually think about that. They just, participate, and, whatever information is coming in at really a very subtle level. But what Dad did is he took that routine gesture that we're all familiar with and chose to use it to create a sense that really, if you look at how trance, the basic structure of trance, you get a focus of attention, turning the attention inward to dissociative response. Those are basically things that happen when one enters a trance state. And so what he did was he created with the handshake a focus of attention by lingering too long, holding the hand in a standardized way, but lingering too long in a, because if you linger, typically you wrap your hand around or you're, doing some other gestures. It's always so wonderful to see or whatever. But he took that formal step of hand grasp and maintained something of a cataleptic posture of his own, as if that moment of hand grasp was frozen in time, to the point where the receiving individual is recognizing something is different. This isn't an ordinary handshake and moving on. Something additional is happening. So he was capturing the focus of attention, and then by continuing with his hand grasp, he started giving indirect suggestions to turn the attention inward. And the way he constructed that opportunity was to transition from the hand grasp, which is slightly higher than normal. Now normal hand grasp is typically chest high or whatever, and he'd do it a little too high with his outreach, little too high. And then he would transition from the handshake into indirect suggestions for catalepsy. And he would do that through ambiguity. As you said, is this going up or is this going down, or is this suspended in space, and what's going on here? And that internal questioning that the recipient was taking in is a dissociative response. It's an opening up of possibilities. It's an internal exploratory, which in essence generates or invites the subject to enter into a trance state. And then what he would do next, as soon as he would recognize that the subject is responding in that way, is that he would ever so gently, even as Catherine described, transition from I'm supporting you to you're on your own, and it's that transition which he became very, very, very deeply skilled at by transitioning from the handshake to now he's supporting, to now he's just barely touching, to now he's releasing, and the hand remains in a cataleptic state, suspended in the air.
Yeah.
And so that is the process. For me, the most interesting part is that transition moment of he's supporting, now you're on your own. It's for me the most fascinating component is that transitional part.
It also may be a symbol or a metaphor of a process of individualization, or becoming more and more independent, or whatever. You can utilize that. When you put it this way, you can utilize that in so many ways during treatment in an indirect form. So, okay.
Well, in today's time, where one of the tragedies of the coronavirus is that people stopped touching each other. They stopped with the handshaking. Like this sort of thing is that we've literally lost touch. And so it's going, and of course, if you're working with a client, you always ask permission if you can touch them. I mean, but you can potentially, when someone walks through the door for the first time, you can potentially extend your hand out, to shake a hand, like that sort of thing. But it is, my question where there is no answer is, I wonder what's going to come next in this world that we live in, where touch is not as predominant as it was, in the 40s, 50s, 60s, like all the way up until what I like to refer to as the pandemico, because it sounds like a dance, so I think it's going to be interesting of what comes next. But anyway, Jan, you were going to say something.
That's true. Although I need to develop your thought into today, even meeting in person becomes less and less popular. So it's who knows, maybe in 10 years time, people will be, like put under the machines, keeping them alive, and be constantly put under into some virtual realities. That's one of ideas. Although I don't want to believe that it's going to be possible.
We always need touch.
Some people will be that way, probably. So I'm thinking to myself, hand levitation, handshake induction, hand mirroring. So I'll just throw a question that goes into, what is with those hands? Why hands and not everything else?
It's that which is represented the most body part that's represented on the brain is going to be the hands. And so when you think of, the sensory motor cortex, so the two come together, and that literally it's the real estate. It's how much area is involved in the brain on that. And so this was one of the reasons why Ernie was so interested in working with hands, is that there really was this brain-mind connection that came with it. And, and even though the book that he and Cheek wrote was called Mind-Body Therapy, originally Ernie wanted to call it Body-Mind Therapy. And, in today's world, that doesn't flow as easily as mind-body. But, that you utilize the best chance of success with things, in life, whether you utilize what a client brings to you, because it's much more likely there's going to be a successful outcome if you do that. So if you're utilizing the hands, for instance, versus the knees, that there's just that much more representation on the brain of the hands, the hands and the fingers, like how much the thumbs are involved, this sort of thing. And so it's really the most likely success is from using hands.
Mm-hmm. Would you like to add something to it, Dr. Roxanna Erickson?
No, I'm just thinking that we've covered a lot of territory in this ideodynamic discussion. And, and now it's time to hand it over to the audience.
That's a good idea. Okay, so let me just tell all of you in the audience. Well, if you have any questions on that or any other matter, or you are interested in some topic that we can develop and talk about or work on, just let us know in the comment section somewhere below this video. So I think we did a pretty good work today, and it was, as usual, a pleasure being with you here and being able to discuss those extraordinarily interesting matters. So thank you very much for today's episode, and see you next time.
Thank you.
Thank you.
This was another episode of our Experiencing Consciousness podcast. Thank you for being with us.
Thank you, Jan. You're the best. Be well, be happy, celebrate life.